Will the vaccine that the UK has the most of work against new variants? A small early study has tried to look into that with the Oxford AstraZeneca vaccine. Scientists found it might offer less protection against the South African strain, and the findings suggest it would be unable to stop transmission. But the researchers behind the jab say it should still defend against severe disease and hospitalisation.
Maybe we won't be reducing the number of cases as much, but we still won't be seeing the deaths, the hospitalisations and the severe disease. And that's really important for healthcare systems, even if we are having mild and asymptomatic infections. To prevent people from going into hospital with COVID would have a major effect.
The findings of the study show how important it is to get on top of variants before they take hold and help explain reasons behind measures like this. Door-to-door testing to hunt down new strains. More postcodes in Bristol, Gloucestershire, Worcestershire and Sefton were added to the list where additional tests will happen. So how concerned should we be? Epidemiologist Professor Keith Neal is cautious but optimistic.
We always knew that mutations would occur because viruses tend to mutate quite quickly, although the COVID virus doesn't mutate anywhere near as fast as the flu virus. The encouraging thing is that it does appear to have some cross cover. That means that the technology of the vaccine can probably be tweaked quite easily.
The Oxford AstraZeneca vaccine is the one that we have the most of. You can possibly imagine people going into a vaccination centre saying that they've heard that it might not be as effective and I don't want that one. What would you say to those people about the vaccination process today, hearing this news?
Personally, I would have whatever vaccine I was given at that time, because what we do know is that if your immune system has a head start, it has an advantage. There are very few South African strains currently in the country, but we do know the Oxford vaccine is very effective against the Kent strain, which has spread across the country. Therefore, that's the one you're likely to meet. So that's the one I'd want protecting against.
As well as vaccination, the other COVID priority right now is getting cases down among people that still have to go out to work. The government announcing they will expand lateral flow tests in England, those are the ones that can give results in 30 minutes, to businesses with more than 50 employees. But unions have warned they are not the magic bullet after criticism during the mass testing pilot scheme in Liverpool that missed some asymptomatic positive cases. The COVID reality right now is while vaccine rollout continues at a promising pace, the number of cases are still quite high. The latest 7-day average of positive tests is just under 20,000. So whether door-to-door, in a car park or at work, testing is more likely to be part of daily life for a while yet.
Well, joining me now is Professor Peter Openshaw, an immunologist at Imperial University. He's also a member of the New and Emerging Respiratory Virus Threats Advisory Group, which advises the government on the threat posed by new and emerging viruses. Professor Aisha raised a good question there in that report. You can see how people might think, well, I don't want the AstraZeneca, thanks very much, I'll take the Pfizer. What would be your message to them today?
There really is no reason at all to have preference of one over the other. They're both excellent vaccines. They've both been approved. And I think, whichever you're offered, take it, because they're both really amazingly effective vaccines against the strains that we currently have circulating in the UK. And it is an extraordinary achievement to manage to not only develop these vaccines, but roll them out so fast.
I mean, we heard Professor Keith Neal there also say that while it might not work quite so well in the South African variant, there are signs that it works very well with the Kent variant. That is the nature of vaccines, isn't it?
That is. And, it is looking like we're going to have to update these vaccines much in the same way that we update the influenza vaccines, both for the northern and for the southern hemisphere. So every 6 months, there's a review committee which decides which are the most common strains, and the vaccines are adjusted accordingly. And that's perfectly feasible to do, especially with the RNA vaccines, which is just a matter of programming the chemical synthesis to make a different strand of RNA. So that is extraordinarily straightforward, much easier than with the conventional old-fashioned flu vaccines, where they had to be, picked and then grown in embryonated eggs, which was quite an ordeal.
I mean, this idea of booster jabs, we know with flu it tends to be for older people and people who are vulnerable in some way. Do you anticipate that we'd all have to have booster jabs for COVID?
Well, the more people who are vaccinated and protected, the better, because we really want to reduce the amount of circulating virus. I think very important message is that at the moment, with the vaccine rollout happening so fast, the lower the rate of infection we can have in the community, the less likely it will be that we will see mutants emerging. So it's really so heartening to see the rates falling, but we've got to keep that fall sustained. We've got to get the levels really down low so that we can complete the vaccination program.
And of course, as you say, the rollout is doing really well in terms of speed, but it's not enough, is it, just for countries like ours, for richer countries, to have their populations vaccinated? This needs to be much more widespread, doesn't it?
Yes, I mean, the point has been made again and again that nobody's safe until we're all safe. And one of the great advantages of the AstraZeneca vaccine was that the price point was low, the possibility of mass production was high, and the and also the cold chain was not really so necessary, because you could just roll it out at ordinary vaccine temperatures and it would reach different parts of the world more easily. So it was a vaccine which is really attuned to the low middle income countries, as well as being optimized for the UK. So it is very important that it is going to be updated for the most common circulating strains.
And just very briefly, as we see the vaccination programme move so swiftly, do you see a point when lockdown is lifted on the horizon?
Well, we'll have to wait and see. I mean, from the point of view of the science, it's so important that we get the rates down really low. I do appreciate that there are different pressures on the government to try and open up the economy, but if you look globally, the countries which have done best are those which have actually followed the scientific advice and got really low rates, and they've been able to open up their economies better.
Professor, thanks very much for talking to us today. Thank you.